This started with a phone call from a veterinarian, clinical presentation of pigs at loadout. Some pigs would only walk for short distances and then collapse. Some pigs didn't want to get up at all. And so the submitting veterinarian was really curious about the lameness issue in these pigs, since historically they've had hyossynovia in these pigs before. We found hyossynovia, and so he's wondering if that was the case with these pigs. So the veterinarian sent in whole legs for a diagnostic workup. They were from euthanized pigs. They were nice and fresh. Got those into the lab, and we went through a typical workup on them. Opened the joints up, and I noticed I didn't have any gross lesions in the joint, which made me suspicious that they didn't get the right pig. We didn't see any bone fractures. We split the bones on the bandsaw. I didn't see any abscesses in the growth plates. We went ahead and tested the tissues anyway, just to make sure we didn't have anything going on there that we didn't notice. And again, the negative tests can give you some value in what's not there. So aerobic cultures were negative. All the PCRs for the mycoplasmas, erysipelas, and Haemophilus parasuis were all negative. And so I didn't have a good reason for this clinical presentation of these pigs at loadout. And so a while later, I got a call from the same veterinarian, and the same clinical problems. Pigs at loadout didn't want to get up, only walk short distances and collapse. The veterinarian sent me a video of one of the pigs. Some of them will have this red and blotchy appearance on their skin. So if they lay down, they seem to, looks like they start to feel better. Why they thought this was an arthritis issue. Pigs are taking those small little steps. So again, you can kind of see how you may go down the road of looking at this as an arthritis issue. So I got a second chance at these pigs. I got a couple more rear limbs submitted, and did the same workups I did in the first group. But light finally went on and decided I needed to look at skeletal muscle in these pigs also, in addition to the joints. And there were no gross lesions in the joints. There were no histopathic lesions in the joints. But we did have some skeletal muscle necrosis lesions showing up in these pigs. So, again, as Matt has already gone over. This is a normal skeletal. This is a normal skeletal muscle section from a pig. You can see all these cross striations going on. And this is what we start to see on when you look at skeletal muscle in cross section. These bundles are normal, and start to see these, as Matt described with ionophores, very similar. You start to see these homogeneous eosinophilic or pink bundles showing up in the muscle. Just a higher magnification. Again, you can see these well-aligned fibers and cross striations, and these muscle bundles are just turning, losing their definition and turning pink and homogeneous. Just another bundle that, again, is really early, going to undergo necrosis, degeneration. This is actually, I'm getting ahead of myself a little bit here. This is a section of diaphragm, and as you can probably tell from all this pink and blue material in here, that's a really severely affected muscle from a pig. And then just a closer examination of these muscle fibers. Again, if you remember what Matt talked about, it looks really similar, if not identical, to what he was seeing. Macrophages, few eosinophils showing up in these areas of tissue removal or cleanup. And so, went into the history. I had the recent history with Rebecca and her ionophore toxicity case. And so, this mill had owned all their own feed mill, all their own mills, and used no ionophores in the diet. We decided to test the feed anyway, just so we can get a definitive rule out and make sure there wasn't a mistake somewhere along the line. Liver mineral analysis, liver selenium, vitamin E, and again, I have never seen a syndrome of white muscle disease in pigs, including older pigs. So again, a lot of these we're running to try to rule out a lot of things. Gas chromatography, mass spectrophotometry. It's a way to look at toxic organic elements that may be in the liver. A number of years ago, I had a case with pigs with rear limb weakness. We did analyze the feed and liver, and we found a small amount of a toxic insecticide substance that does cause some demyelinization in pigs. So that was one thought I had in the back of my mind. Feed mineral analysis, calcium, phosphorus, vitamin D. We wanted to rule those out also. And so we couldn't find anything of our normal rule outs for this, so we were suspicious that this may be a hereditary problem, and we wanted to look how extensive this was in this system. So they went down to the plant when pigs were going for market. They selected diaphragms from 7 different flows within that system. So we looked at 213 diaphragms, and 81 pigs had lesions varying from mild to very severe. And so affected, of those 213 had 38% of the pigs had lesions. There were lesions in multiple different flows. Some flows were affected more than others. So, got a third chance at these. They submitted live affected pigs, clinical pigs, to the lab. And we wanted live pigs so we can do a study on electron microscopy and also do frozen sections for Dr. Valberg, and to see if we could identify any structural abnormalities going on in these muscle fibers. And so no abnormalities were identified by frozen tissue sections, and by electron microscopy there are no structural changes in these muscle cells. We also did whole blood analysis for porcine stress syndrome. If you're young enough, you may not have seen porcine stress syndrome before, but I can recall my first case of porcine stress syndrome, and it looked almost essentially like that first pig up there. difficulty breathing, painful, red and blotchy skin. Recently, we were trying to pursue genetic causes for these, or hereditary causes, and I wasn't coming up with too much, and I got an email from Dr. Valberg one morning, and it said, "Hey, have you seen this? Did you consider this?" And it's a study done in Europe about a myopathy in pigs that they referred to as campus syndrome. So this was a condition, hereditary condition. They found a gene defect in Pietrins. So you see something similar clinically. You got a pig that looks painful and is shaking. And so somewhat similar in nature. The pigs lay down. They seem to be a little less affected clinically. And so we thought maybe we had a possibility for a diagnosis of what was going on in our pigs with this campus syndrome. And so we took advantage of their article, got PCR probes for that specific gene changes on those. And then there's also an ELISA test you can use for this, looking for values relating to myoglobin on those. In those pigs, and no such luck on these pigs. Couldn't find that similar gene defect in our pigs. So we don't know what's causing this. Still suspicious of a hereditary problem. There are other. I was just reading recently on a condition in people. It's called hereditary hemorrhagic telangiectasia. It's a weakness in blood vessels. It has a set of clinical signs that physicians should see and associate with this, and so if they see 3 or 4 out of the 5, they have a diagnosis of that particular syndrome. But since more study has gone on that, with that same clinical syndrome, they found 600 different gene defects associated with that syndrome. So it can be kind of a needle in a haystack type of search for some of these mutations that may show up. So if any of you have seen pigs like that or know the answer, please let me know.